Move over to Guinea, where the health agency there has confirmed a new Ebola outbreak in that country. 7 cases and at least 3 deaths have so far been reported in the country's southeast region. 7 of those who had contracted the illness are reported to have attended a funeral in Goueke Town early this month. The health ministry says that they are contact tracing individuals who may have come into contact with the sick. Some are already in isolation.
Very early this morning, the Conakry laboratory confirmed the presence of the Ebola virus. So this puts Guinea in a situation of Ebola epidemic. There were a total of 7 cases, including 3 deaths. Of the 7, 4 were men and 3 were women. 3 were isolated, 1 in Conakry and 2 in Zerekore.
The 7 cases are the first declared since the country last battled the disease about 5 years ago. The government has sent an emergency team to support local teams in Goueke and has accelerated the procurement of Ebola vaccines from the World Health Organization. Health experts in Guinea say these latest cases could be a major setback for the country, which is also battling COVID-19. The new cases are in the same region where the previous Ebola epidemic started in Guinea. More than 11,000 people died in that outbreak, which also hit neighboring Liberia and Sierra Leone between 2014 and 2016.
I was in panic. I couldn't even control myself when I learned that Ebola has returned to Guinea because of what we went through in 2013 and 2014 with Sierra Leone and Liberia. We are Africans, we are poor, and if diseases like Ebola or the coronavirus appear in Africa, it is only God who will save us.
Well, earlier we spoke with Tejan Bangura. He is a journalist and Sahel specialist from Conakry, Guinea. This is what he had to say.
The National Health Agency director said that they have officially declared the outbreak of the Ebola pandemic in the country. And the second was sending a mission to the southern region where the disease was discovered. And that mission would be delimiting the area of contamination and also contacting possible suspect contacts. And the third one would be to discover what is the origin of the disease. It is from a former patient who was killed and the disease came back in the body, or is it from an animal origin? So these are the measures taken by the government till now concerning the Ebola disease. What's been here from the government official is that the country is prepared, according to them, because this is not the first time we've experienced Ebola. For the first outbreak in 2014, 2015, we have had care centers that are specialized in treating this kind of diseases. Well, from what has been heard is that the government officials seem to be confident that they've had care center in Guinea, in a lot of care centers in Guinea, especially in the southern region where the Ebola disease was discovered, and in Conakry, and they have also called upon doctors and medical personnel that were sent to ID Congo to fight against the Ebola disease there. So we have means to fight against the corona. Not the corona, but the Ebola outbreak. So the government officials seem to be very, very, very confident, and they are sure that with the care center that we have and with the medical personnel that we have, we can effectively defeat this second outbreak of the Ebola disease. As for international support, I think the government officials in the meeting yesterday, they were surrounded by personnel of the World Health Organization that promised to help Guinea in fighting this new outbreak of the Ebola disease. For now, there is no vaccine in Guinea to fight against, but the World Health Organization has promised that the vaccine will be brought to Guinea within the next 24 hours or the next 72 hours. So the World Health Organization is actively in touch with the authority of Guinea.